Welcome back and good morning, Central Oregon. I'm joined by two doctors from Ben Memorial Clinic, Dr. Heather West and Dr. Erin Walling. Good morning.
Good morning.
So Dr. West, I'm going to pick on you first. We have seen some incredibly confusing news reports on exactly when women now are supposed to get our screening mammograms. What's the latest recommendation?
So I'd have to say that certainly my recommendation is that women start at age 40. Mm-hmm. There's no debate in the area of age 50 to 69 that women need a yearly mammogram. There was a recent recommendation by the U.S. Preventative Task Force that it was actually based on a cost-benefit analysis, saying that perhaps in the 40 to 50 range, the cost per life saved doesn't merit doing mammograms. Mm-hmm. And this came on the heels of our countrywide debate on how we're spending healthcare dollars. And the way I've responded to that with my patients is saying, while I surely support the idea of being cost effective and looking at those types of analyses, I really feel that mammography, which is something that has saved lives from breast cancer for years and years, mm-hmm. is not the place to start. Additionally, with that study, they actually found a similar benefit in the 40 to 50 range in terms of relative reduction in deaths from breast cancer by initiating screening. Mm-hmm. It's just that there's a little bit smaller incidence in that age range. Okay. And so when they did the whole analysis, they said, oh, perhaps we can wait. Now, that recommendation was only one of about 5 or 6 organizations that put out screening recommendations, mm-hmm. and all the rest were quick to say we're not changing ours. And the one that we are most comfortable and familiar with in terms of being an oncologist, we always follow the American Cancer Society's recommendations, and right. they have not changed theirs. So I strongly support starting at age 40 mm-hmm. for the average risk person, I will say.
Right, and then for those of us, Dr. Walling, who have breast cancer in our family, mm-hmm. we really need to be working closely with our physician because we might need to start those screenings earlier.
Absolutely. If you have a family first degree relative who is a young age, mm-hmm. you would want to at least 10 years right. ahead of time and be obviously working with your family, your physician.
Right.
And that may even actually include Dr. West, who is very involved in preventative, medicines. There's some therapies, there's other options, and some different screenings mm-hmm. that we can do.
Well, and my mother found her lump at 36, which is incredibly young, so mm-hmm. that means I should have had my first mammogram at 26. So I should have been working more closely with my doctor mm-hmm. because you don't think about having a mammogram at 26. Mm-hmm.
Well, certainly we know that that mammograms aren't quite as sensitive mm-hmm. in younger individuals. So if somebody below age 35, there is some debate about how to screen, mm-hmm. but at least you should be seeing a breast specialist to help mm-hmm. screen. The recommendations may vary depending on your personal situation. Mm-hmm. We may use mammogram, ultrasound. There's newer techniques with breast MRI. Mm-hmm. And the most important thing is that if you have a high risk, to actually talk to your doctor about it, and if particularly such a young breast cancer is in your family, talking to a breast specialist is important, not only for screening recommendations, but also for the possibility of deciding things such as medications you might want to take to help prevent breast cancer.
That's right. There's a lot of things to think about. That's for sure. What are my chances, or what are the chances of developing breast cancer, and how can we prevent the disease?
Mm-hmm. The chances for each individual is different. Mm-hmm. The major risk factors that they've broken down, one is age. Mm-hmm. If we reach 90 these days, it's 1 in 8.
Right.
And that's not even accounting for the family history. Mm-hmm. So age is important, and then your family history is really important to discuss with your physician. And as she said, if you have a higher risk, then you're going to want to see a breast specialist to talk about the different options.
Right, but it's my understanding too, even if you don't have a family history of breast cancer, that doesn't mean you have a get out of jail free card, because the most incidents of breast cancer don't have a family history.
Yes.
So
yes.
Don't think that you're just getting out of it and you're off scot-free. It's really still important to make sure that you check. What do I do if I find a lump?
If you find a lump, the most important thing is to get into your doctor as soon as possible. Mm-hmm. And that can be, oftentimes that's your primary care physician. Certainly, we are also open at the clinic, in either of our clinics, to see folks with breast lumps. You don't mm-hmm. have to know you have breast cancer. The most important thing is to get a professional opinion.
Yeah.
A lot of times we'll start, depending on your age and your risk, we may start with just having you back in a month to feel it again, depending on what time it is in your cycle, or we may be very concerned and proceed with imaging and potentially a biopsy at that point. But the most important thing I can emphasize is there's no silly lump. See someone who feels breasts all the time and can help you figure out what's going on.
If something doesn't feel right, it probably isn't. And I should mention, I've never told anybody this before, but my mom was terrified when she found her lump. She didn't go in. She was too scared to go in, and ultimately she did not survive. So please, 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 if you have any issues at all, please call the doctors at Ben Memorial Clinic, benmemorialclinic.com, and then 541-382-2811. Your family will thank you for it. So it was nice to see you this morning. Thank you.
Thank you for having us. It's great to be here.
Thanks.